Hello everyone, here we are again with a practical session in muscle injuries case discussion. This time we're going to talk about a professional handball player. You can see it here. As you know, and as you may know, handball is a very hard contact sport with a lot of contusions, a lot of contacts between players. And what we have right now is a 26 years old handball player which suffered a direct contusion in the right thigh with the muscle quadriceps complex in contraction. That means that it is a worse prognosis than if the muscle is in relaxation due to the contraction of the muscle itself. He went under an ultrasound scan in Germany at 72 hours, more or less. That was 2 months ago, 2 months after he came to my consultation, to our clinic, with a marked worsening of symptoms. The treatment that he had done until then was a deep massage, repeatedly, focused ultrasound, sport rest for more or less 3 weeks, and training according to tolerance. So, when he arrived to our consultation, it can be observed, as you see, a marked increase of the volume of the right thigh if you compare with the left one, and a severe decrease in the range of movement of the knee and heart stiffness and pain. It was really painful when in the palpation, and we performed the ultrasound, and the ultrasound, as you can see, it showed very anechoic area here in the transversal plane, here in the longitudinal plane. It's quite anechoic. That means that there is still an hematoma 2 months later, but the thing that makes to focus our attention is that we can see calcium walls surrounding this hematoma, even in the transversal plane and in the longitudinal plane. So that means that something is happening here, some more than just grade 3 contusion injury. We can see that the hematoma is located in the vastus intermedius here. So we can see in the video here, we can see that this hematoma, it's inside the vastus intermedius, as I said, and then there is a surrounding wall of calcification area, even in the transversal plane or in the longitudinal plane. Look at these calcium walls here. So what we had, we have an ultrasound guided drainage of this hematoma because it was here in tension, so we were some kind at risk of making a compartment syndrome because it was really stiff, and being careful not to go across the calcium walls, I entered through the hematoma and I removed the hematoma. So you can see that we have here the calcium walls, and here in the video you can see that there is no hematoma, but we can see some pieces of the calcium walls. So we made a little bit of compression to avoid the refluid, the hematoma to come again, and we look at the patient after 15 days more or less. I talked with the orthopedic surgeon that he decides that this was not a surgical injury, and I saw the patient 15 days later, and as you can see here, what it has been, it's a really hard formation of calcified walls where the injury was, and of course this corresponds to a myositis ossificans. This is quite a common complication of the muscle injury contusions, especially those of a elevated degree, but we have to take into account some things about the myositis ossificans that we're going to show you in these key points concerning the myositis ossificans injury. First of all, that you need to know that when there is a muscle injury due to contusion, deeply massage, especially deeply massage, is absolutely forbidden because it's one of the best promoters of the myositis ossificans. And if we have to know also that there are some things that shows us that there is a risk of developing the myositis ossificans after contusion injury, and if there is a hard decrease of the knee range of movement, a late start in the treatment, a deep massage, and an early return to play. And if you combine all of this, the risk of developing a myositis ossificans is really, really high. Another thing that we have to know, this is not a calcification of the injury. The myositis ossificans is a metaplastic bone neoformation, so it's not a calcification, it's a metaplastic reaction of the bone. That's why in cases like that, if there is a big hematoma, obviously we need to drain this hematoma, because if not, the healing is very slow if it exists. As you could see, when there was the hematoma, the myositis ossificans, the calcified walls of the injury were not completely formated. When we removed the hematoma at 15 days, the calcified walls of the myositis ossificans were completely homogeneous. So this is the first start of the healing of the myositis ossificans. So in the cases that we suspect that it could be a myositis ossificans, the treatment is police treatment, the typical police treatment, plus indomethacin, because indomethacin makes an inhibition of the metaplastic reaction of the bone. So in this particular case, the return to play was 2 months previously coming to our clinic and 3 months more later to resolve all the picture. So it took about 5 months to resolve. Normally, if there is a grade 3 contusion in the vastus intermedius, it is normally of about 2 months of a return to play, and if there is myositis ossificans as a complication, it took about 3 months. So this case was really a complicated case, but and it took 5 months. But normally, it's not about this amount of time for the return to play. So that's it. Hope you enjoy this small case discussion, and hope to see you in my channel. And I prefer you subscribe to the channel, and let's see if we can make another case discussion or a brief discussion about some topics. So thank you very much.